thin tongue bodies. Good evening, Sir Dino.
Good evening, Doc. Good evening po sa lahat. Now we continue with the tongue diagnosis, thin tongue body. A thin tongue refers to the thickness and not the breadth of the tongue. A tongue becomes thin when there is too little fluid or too little blood to fill the tongue. Example, there is too little yin in the tongue. This will be due to there being too little yin and blood in general, or there being something that has damaged the yin aspect, which will be some form of heat. The color of the tongue will be the determining factor. A red tongue indicates that there is heat, damaging the yin aspect, and a pale tongue that there is too little blood. So, yung coloration ng tongue, siya po ang magdedetermine, like kung having heat pattern, the color of the tongue body is red, or having a pale tongue, ibig sabihin there is little blood. A thin tongue is not seen as often as might be expected. So halos hindi na bihira po. Many clients are blood deficient and yin deficient, but they also have dampness and phlegm. This result in their tongue being swollen. So supposedly, mga thin tongue ito, but because of the presence of dampness and phlegm, it resulted to swelling of the tongue. This means that a tongue that would otherwise have been thin due to blood deficiency or yin deficiency can be swollen due to the presence of dampness and phlegm. Okay, sa pale and thin tongues, a lack of blood and body fluid causes a decline in the volume of the tongue body, which is manifested in a thinning, shrinking, or contracting of the tongue body. Depending on the individual's constitution or life circumstances, spleen-chi deficiency may lead either to accumulation of dampness or lack of blood. So, ang pagkakaroon ng spleen-chi deficiency, it's either pwedeng magkaroon ng dampness or lack of blood. Both are secondary aspect of disharmony of spleen-chi. Any long-term deficiency will lead to impairment of the transformation of food into blood. Because of this, every pale tongue reflects an element of blood deficiency. However, when blood deficiency is an important contributory factor to an illness, it is expressed in a pale and thin tongue body. At the onset of such pathology, it will be pale and dry. So yan po yung pagkulang. This is especially true in women who suffer from profuse menstrual bleeding, breastfeeding for long periods of time, or follow improper dietary habits. A thin, pale tongue is an important feature in individuals who suffer from lack of blood. So, kulang yung blood. If this condition is not treated, kidney deficiency may develop as blood nourishes the yin. So, pag kulang ang blood, maapektuhan po and magkakaroon ng kidney yin deficiency. The development of this particular pathology is visible when the pale tongue body changes its shape or takes on an intense red or orange tinge. If the pale tongue is dry, the pathology is not so severe. That is, the blood has lost its moistening function, but the deficiency is not yet significant. Typical symptoms of blood deficiency are dry or itchy skin, hair loss, a pale tinge to the skin, numbness in the extremities, and dizziness. So, having a blood deficiency, nagkakaroon po ng numbness sa mga extremities and ang pagkakahilo. So, we have here a patient, a male, 41 years old. Ang tongue po niya is pale red, slightly thin. So, observe po natin yung picture. Ibig sabihin, there is a slight spleen-chi deficiency or blood deficiency. Meron din siyang rolled up edges. So check natin yung picture. Ito po yung sides. Umaangat po ng konti yung edges. Ibig sabihin, there is a liver chi constraint. Next, meron siyang slight depression at the root. Dito po sa may likod ng tongue, may depression. Ibig sabihin, there is a slight essence deficiency. So this patient has symptoms of deep exhaustion, meron siyang depression and backache. Sa the Western diagnosis, there is none. And yung background to disease, overwork, hectic lifestyle, there is emotional problems, excessive sexual activity. Next patient is a female, 38 years old. So meron siyang pale and thin tongue. Observe natin yung picture. Ibig sabihin, there's a spleen chi deficiency or blood deficiency. And meron din siyang curled up edges. Tingnan po natin yung picture, yung sides po niya, umangat ng konti. Ibig sabihin, there is a liver chi constraint. Meron din siyang reddish center. Ibig sabihin, there is heat in the stomach. Ang depression at the root, kung titingnan po yung likod ng tongue, may depression. Ibig sabihin, there is an essence deficiency. So this patient has a symptoms of deep exhaustion, burning around the anus, may anal pain, may constipation, lack of appetite, may insomnia. Sa Western diagnosis, meron siyang inflamed hemorrhoids. Sa background to disease, there is strong demand at work and home. Unhappy marriage, there's a constant frustration, poor pregnancies, and caffeine abuse. Okay po. Next patient, we have a female, 35 years old. Ang tongue ng patient is pale and thin. So, indicating that there is a slight spleen chi deficiency or blood deficiency. Meron din siyang pale edges, which indicate that having a liver blood deficiency and may slightly dry, thin crack in the center. So, tignan po natin yung picture. May crack po dito sa may middle, indicating that there is slight stomach indeficiency. So the patient has symptoms of exhaustion. There is acute diarrhea with blood and mucus. There is hair loss, short menstrual cycle. There is intense fears. And sa Western diagnosis, there is ulcerative colitis. Sa background to disease, meron siyang helminthies that were improperly treated in India. There is emotional problems. Vegetarian ang diet po niya and nagpa-fasting. Next patient, we have a female, 25 years old. Ang tongue po ng patient is pale, slightly thin. Middle part of sides are swollen. So check po natin dito. May swelling po dito sa may sides, yung middle part, indicating that there is a spleen chi deficiency and blood deficiency. Meron din siyang white, thin, slippery coating. Okay, check natin the picture. Indicating that there is accumulation of cold dampness. This patient has symptoms of headache, pain at the nape of the neck. There's fatigue and weight gain. Sa Western diagnosis, there's none. And yung background to disease, there is excessive consumption of sweet food and excessive worrying. Okay. Next, we have a female and 34 years old. Ang tongue po niya is red, thin, and cracked. So check po natin yung picture. Ibig sabihin, this indicates that there is blood and kidney deficiency. The coating is without root, indicating that there is a stomach and kidney yin deficiency. The patient has symptoms of severe exhaustion, inner restlessness. There is sore throat, numbness of the left thigh, frequent dizzy spells, occasional night sweats. Sa Western diagnosis, ang patient mayroong multiple sclerosis, there's chronic tonsillitis, there's blindness due to optic nerve atrophy of the left eye. Sa background of disease, the patient, there is irregular eating habits, frequent bouts of influenza, and long-standing emotional problems. Okay, sa next patient, we have a male, 38 years old. Ang tongue po niya is red, slightly thin. Okay, observe po natin yung picture. Ibig sabihin, the patient has kidney deficiency. Merong crack, coating without root. Okay, observe po natin yung picture. Ibig sabihin, there is a fluid and kidney deficiency. Yung red tip naman indicates that there is heat in the heart. The patient has symptoms of severe exhaustion, may depression, lacking self-worth, may night sweats, and sore throat. Sa Western diagnosis, there is chronic tonsillitis. Sa background to disease, there is a long-standing emotional problem since childhood. There is suppressed anger, and the patient is overworked. Okay. Next, we have a female, 59 years old. The tongue is deep red with thin, small, and short. This indicates that there is presence of kidney deficiency. There is also depression in the anterior third. So observe po natin yung picture. Sa harap po ng tongue, there is a depression indicating that there is presence of lung qi and yin deficiency. Redness in the anterior third. Okay, mapula po dito. Sa may harap ng tongue, indicating that there is heat in the lungs. The patient's symptoms is dry cough, merong dry mouth and throat. There is pain in the chest, hair loss. There's lack of appetite. Sa Western diagnosis, there is metastasizing bronchial cancer. Ang background to disease, possibly environmental factors and chemotherapy. Okay. Next patient is a male, 22 years old. Ang tongue po niya is reddish, big, and slightly thin. This indicates that there is an onset of kidney deficiency. There is horizontal cracks. Okay, observe po natin yung picture, yung horizontal cracks. Rough tongue surface, which indicate that there is an onset of stomach deficiency. Yung deep vertical crack in the anterior third. So meron dito sa may harap ng tongue, indicating that there is a lung deficiency. Ang symptoms ng patient, there is chronic nasal congestion, pain and pressure in the nasal sinuses. There's feeling of tightness in the chest and asthmatic attacks. There's tendency to catch colds. Sa Western diagnosis, there is allergic rhinitis, allergic asthma. Sa background to disease, meron siyang family history of allergic rhinitis and asthma, merong poor diet during puberty, emotional problems due to the divorce of parents. Okay, next patient, we have a female, 42 years old. Ang tongue niya is reddish, which indicates that there is a slight kidney deficiency. Cracks distributed over the entire tongue body. So check natin yung picture. Marami po siyang cracks, which indicates that there is a stomach and kidney deficiency. Center of the tongue is red and without coating. Okay. Which indicates that there is a stomach deficiency. Yung thin yellow, one-sided coating. So observe po natin, may yellowish part sa one side. Slight retention of damp heat in the liver and gallbladder. So on symptoms ng patient, there is a burning sensation of the tongue, night sweats, there's palpitation, insomnia, frequent smelly loose stools, pain under the right hypochondrium, there is inner restlessness. Sa Western diagnosis, there is none. And sa background to disease, the patient is overworked, caffeine abuse, and pregnancy at a late stage. Okay. Next, we have a male, 42 years old. Ang tongue po niya is slightly pale and slightly thin, which indicates that there is a spleen Qi deficiency with blood deficiency. Ang tongue is thin with vertical cracks at the center. Okay, observe po natin yung picture, which indicates that there is an onset of fluid deficiency in the stomach. There is also a transverse crack at the sides, indicating that there is a severe spleen Qi deficiency. Yung red points at the tip, so meron siyang mga red points, indicates that there is heat in the heart. Ang symptoms ng patient, there is pressure pain under the ribs, there is depression, may constipation, and fatigue. Sa Western diagnosis, there is poisoning through the pesticides. Sa background to disease, pesticide poisoning. Okay? So next patient, we have a female, 38 years old. Ang tongue po dyan is slightly pale and thin. Okay, check po natin yung picture, which indicates that there is a spleen Qi deficiency with blood deficiency. The tongue is also pale, slightly curled up edges. So yung sides po, slightly paangat, meaning there is a liver blood deficiency, liver Qi constraint. There is also a deep cracks at the sides. Okay, tingnan po natin yung picture, which indicates that there is a long-standing spleen Qi deficiency. Okay, yung symptoms ng patient, there is a severe mood swings, there is a depression, exhaustion, there is soft stools, intense menstrual pains. Sa Western diagnosis, the patient has anorexia nervosa. Sa background to disease, sexual abuse, and repressed emotions. Okay? So, ito po yung case history nung last tongue picture. As a small girl, Mrs. Zay has repeatedly sexually abused by a relative, and she never fully recovered mentally from this experience. To this day, she suffers from depression and mood swings. From ages 16 to 25, she suffered from anorexia nervosa. She now eats regularly and has opted for a vegetarian diet. Her bowel movements are regular, but the stools are soft. She suffers from severe menstrual cramping. She tries to fight her inner tension by jogging. She jogs many hours a day in all weather, even though she feels exhausted. Her face is noticeably yellow. The pale red tongue body is thin. The edges are curled up, and the sides of the tongue shows numerous transverse cracks. Her pulse is very thin and very wiry and thin. Okay? Sa analysis, that patient's sexual abuse in childhood was the basis for her mental and physical sufferings, if not only caused by liver Qi constraint, but also blood stagnation in the penetrating vessel. The Qi and blood stasis are responsible for the menstrual pains. The constrained Qi led to inner tension and mood swings, which is clearly visible in the curled up tongue edges. The wiry pulse confirms this diagnosis. Okay, so we correlate it with the pulse. Her chronic starvation for 9 years injured the postnatal Qi. Although she started eating regularly again, the deficiency of spleen and stomach Qi did not vanish, but manifested as fatigue. The deficient spleen Qi failed to adequately transform the food into blood, a condition exacerbated by her vegetarian diet. The thin tongue body denotes deficiency of blood. This is especially apparent in the pale tongue sides. Due to her excessive jogging, her Qi weakened even more. It is true that exercising contributes to moving constrained liver Qi and helps one mental condition. but this will only be of short time. Here, the excessive exercise and the continuing transverse rebellion of liver qi injure the spleen qi. The severity of this pathology is reflected in the transverse crack at the sides of the tongue. The weight loss may be due to the exercise, but may also be associated with spleen yin deficiency. Okay? Sa discussion, the cracks appearing at the sides of the pale tongue indicate deficiency. In such cases, patients will always complain of deep exhaustion and fatigue. This is important that such patients eat and rest regularly. So having a severe spleen qi deficiency, patient always complain of deep exhaustion and fatigue. So kailangan po niya kumain ng healthy food and magkaroon ng regular rest. If the tongue body is red, there may be symptoms indicative of kidney and spleen yin deficiency. Besides dry mouth, lack of taste, and emaciation, there may be night sweats and sensation of heat in the body. A red tongue with transverse crack on the sides must be taken seriously because it reflects not only injury to the kidney yin, but also to spleen and stomach yin. So, importante daw na pag may red tongue with transverse crack, di ba yung mga cracks dun sa side ng tongue, importante po yun because this is injury sa kidney yin, sa spleen and stomach yin. Okay po? So, thank you po for your attention.